Hello, my name is Heather, and I am a registered nurse. I have been a nurse for 5 years, and I currently work on a cardiac unit. I am here to give a presentation on congestive heart failure or heart failure. So, heart failure is a major health problem in the United States and is currently affecting more than 5 million people. This is an informative speech on how to manage a life with a new diagnosis of heart failure. So you guys are here today because you or a loved one have recently been diagnosed, and I am here to give you tips on how to stay out of the hospital. Heart failure is the leading cause of hospitalization in people over 65 years of age. You do not have to be one of those statistics. The term heart failure simply means that your heart is not pumping as well as it should. With the right care, heart failure will not stop you from doing the things that you enjoy. Your prognosis will depend on how well your heart muscle is working, your symptoms, and how well you manage and respond to your treatment plan. The most common causes of heart failure is coronary artery disease that occurs when arteries that supply blood to the heart muscle become narrowed by buildup of plaque. So, what exactly happens with heart failure? In heart failure, your heart does not pump enough blood and it starts to back up into your veins. Fluid then starts to accumulate in your body, causing swelling in your feet, ankles, and legs. This is called edema. Fluid can start to build up in your lungs, which can cause pulmonary edema, and then your body does not get enough blood, food, and oxygen. When all of these things happen together, patients become short of breath and fatigued, and they need admitted to the hospital for further management. I am here to speak of the basic diet, exercise, and medication compliances to keep your heart strong and to keep you out of the hospital. Planning what you eat and balancing your meals are very important to managing your health. One thing that you can do is control your sodium level. Sodium retains water, which can cause swelling and weight gain. Decreasing the total amount of sodium to 2 grams per day or 2,000 milligrams is one of the most important ways that you can manage your heart failure. Limiting your fluid intake to 12,000 to 18,000 milliliters in a 24-hour period is also very important so you don't hold on to fluid. Eating a variety of foods to get all the nutrients you need and learning how to read and understand food labels is very important. It helps you make smart food choices and stick to that 2-gram salt diet and fluid restriction. Now that I have talked to you about the importance of maintaining healthy diet, it's time to turn to exercise. One of the most important habits to start is daily weights. Weigh yourself on the same scale around the same time of day to check for weight gain caused by increased fluid. A general rule of thumb is to call your primary care physician if you notice a 2-pound weight gain in a 24-hour period or a 5-pound weight gain over the course of a week. It's important to lose or maintain your body weight based on your doctor's recommendations, and performing a moderate exercise 3 to 5 times a week can assist in this weight loss goal. As you can see, diet and exercise go hand in hand, playing a very important part in managing your heart failure. Medication compliance is key in limiting exacerbations and hospital admissions. You should always follow your doctor's advice. Monitor your blood pressure, quit smoking, and take your medications exactly as prescribed. Doctors usually treat heart failure with a combination of medications, and depending on your symptoms, you might be able to take one or more of the following. I'm just going to go over a couple of the common heart failure medications that people are typically on. Something called an ACE inhibitor is a medication that will widen the blood vessels to lower your blood pressure and improve the blood flow and decrease the workload on your heart. Beta blockers are a class of drugs that slow your heart rate and reduce the blood pressure, but also limit or reverse some of the damage done by heart failure. And diuretics or water pills make you urinate more frequently and keep fluid from collecting in your body. This also decreases fluid in your lungs so you can breathe more easily. Excuse me. These medications reduce the risk of some abnormal heart rhythms and lessen your chances of dying unexpectedly. They also reduce signs and symptoms, improve your heart function, and help you live longer. In conclusion, I hope that you take the information presented and further educate yourself on your new lifestyle. Remember, a diagnosis of heart failure does not mean a life sentence in the hospital. Join me in attempting to reduce hospital admissions and readmissions for noncompliance of heart failure. Let's manage a healthy life and take over our health. Thank you.